Hello, everyone. Welcome to another special presentation from Lump, Pulse Diagnosis Made Easy. And today we shall be discussing the methods of pulse taking. The best time for pulse taking is in the early morning before getting up or eating. The duration of each pulse taking must be at least 50 beats. Now, this may not seem very practical if you see the patient in the clinic, no? But we are focusing on patients who would like to take control of their health. So you can start by checking your own pulse um, before you get up in the morning or before you eat, okay? Position of the patient's body. The patient should be sitting erect or lying supine, keeping the chun-shu at the same level as the heart with the arm resting flat, the palm facing upwards. Or you can order yung tinatawag na there's a cushion for the for the for the wrist, okay? Fingers method. A, placement of the practitioner's fingers. The tip of the three fingers should be aligned. So firstly, you press the middle finger on the one region, and then you palpate the pulse using only the pads of the fingers. The reason why we check the guan first is because we want to locate the radial pulse right away, no? The styloid process of the radius. Attention should be paid to adjust the spacing of the fingers in relation to that of the patient's size. Okay, then we have manipulation of the fingers. This includes lifting, palpating, searching, mild pressing, and heavy pressing, single pressing, and simultaneous pressing. Normal and calm breath. The practitioner's breathing should be natural and quiet. The practitioner should count the number of pulse beats during a full cycle of the patient's expiration and inspiration. So these days, because we have a watch, we want to find out the breathing, no? So kung gaano kabilis using the watch. So if the patient has calm chi and blood and a quiet internal and external environment, this pulse is relatively true. The practitioner should keep his breath natural and uniform to count the pulse beats of the patient. The edge of the boundary of the finger belly, the position between fingertip and finger pulp. Take note, between fingertip and finger pulp. This is a sensitive region for the sense of touching. The commonly used manipulating methods are lifting, palpating, searching, mild pressing, pushing, combined pressing, and single pressing. Lifting. In lifting, okay, I hope you can do this with me together. Place the fingers slightly upon the skin. So we're actually uh, checking the superficial level. Lifting. Parang inaalsa mo. Palpating. When you palpate with a heavy force. So we're actually checking the deep level. Seeking, we press the fingers to the muscles. We vary the pressure to look for a more distinct pulse reading. Mild pressing, the fingers moving along the longitudinal direction of the vessel to understand how long or wide or short a pulse it is and the deficiency or excess nature of the pulse strength. Pushing, pressing the vessel with the belly of the fingers and slight pushing to the left, right, exterior, and interior. Then combined pressing, three fingers apply palpation and press simultaneously so the practitioner distinguishes the pulse images in total. Then we have the single pressing. The practitioner uses a single pressure. So this is to distinguish single pressing from combined pressing. In combined pressing, we use all three fingers. Single pressing, we use a single finger to examine a specific portion of the pulse image, such as the Sun Wan Shi. Now let's go to your favorite part of the session, the assessment. Okay, so how do we do placing the fingers? Okay. Paano po yon? Is there anybody who would like to answer? O nakalimutan nyo na?
Hi, Doc.
Okay, can you do it? Yeah, how do you press how do you what's this?
Place
How
the
do you place
fingers.
the fingers?
Placing the fingers, the index, middle, and ring fingers simultaneously on the radial artery to
Okay.
make initial assessment.
Yeah, very good. Yon. Okay. How do you arrange the fingers?
You should spread the fingers slightly or press them close together according to the size of the patient's arm.
Okay, so if the patient is bigger than you have to uh, spread the fingers
A little
a little farther, diba? Oo.
further.
So what about if your patient happens to be a 1-year-old?
Um,
So
can
usually isang
feel it
finger
with
lang.
one finger. One
Yeah,
finger.
very good. Now let's go to regulating the fingers. How do you regulate the fingers?
We should place the fingertips on 3 positions, allowing for the different length of the fingers.
Okay, very good. What determines the size of the blood vessel?
The chi and blood is a reflection of the Zangfu organs.
Okay. Of course, no? Qi and blood. Qi and blood are always together. So that would determine the size of the blood vessel. And of course, the Zangfu organs. What determines the strength of a pulse?
The chi determines the strength.
Okay. So in our practice, we're actually determining if the pulse is strong or weak. So if the pulse is strong, or too strong, we would look at an excess condition or a strength condition. If the pulse is too weak, we would be looking at a deficiency condition. No? Yeah.
Yes.
Good. What determines the length of a pulse?
The chi and blood, since the chi moves the blood.
Okay, very easy, no? Don't worry, yung mga beginners, I will post the answers later. What determines the rate of a pulse?
The state of yang chi, like the
Oh,
movement of blood from via lungs and heart.
okay, so if you happen to have a patient whose pulse is too fast, compared to the tongue, it would be very easy to effect a change in the pulse. So you have to make sure that you know what you're doing. So basically, if you have a rapid pulse rate, you would be looking at a heat pattern, no? So you would be using points that will definitely get rid of the heat. Okay. Or if you have a pulse rate that is too slow, and make sure that within maybe less than a minute or maybe a few seconds, if you know the points, then you would be able to bring back the pulse rate to normal. Okay. And the patient should know this. Okay. So this is the kind of training that we give you at lab. So,
The question.
yes.
What if irregular heartbeat, doc?
Oh, pag irregular heartbeat, we would usually look at the heart pulse, and we will reserve that for next time. Okay. Wag na muna tayo doon sa irregular.
Oh, okay.
Doon muna tayo if you notice, wala tayong question about irregular heartbeat. Actually, it's so when you say irregular, we have irregularly irregular, we have regularly, yung ganon. So it is, I would rather that we discuss it face to face, no? Mhm.
Doc,
So
I mean,
it's don't look, yeah. Any
rapid pulse, doc, excess.
No. Rapid pulse simply means na may heat, excess yung yang, too much yang qi. Okay? Pag sinabi mo kasing excess, you would always look at the strength of the pulse. Okay? You need to know the difference.
Doc,
Okay?
thank you.
Mamaya na po yung irregular ha, kasi nakaka-stress yung irregular. By the way, um, our ambitious plan is to actually deal with all the pulses. Yung mga commonly seen lang in the clinics. So I was thinking we should not stress ourselves too much. So for those who want to really study ahead, you might want to be a part of the Pulse Matters. Andun na lahat ng videos. In fact, there's one clinician there from Canada. Talagang detailed yung pag-discuss niya. No? Okay. So you email me at hector_cruz_md@yahoo.com.ph for instructions. Okay. So again, if you're talking about excess, you are determining the strength of the pulse. So if it's too strong, that's excess. And again, you just don't rely on the pulse. You have to also look for other signs or symptoms, like if the patient is in pain, ayaw niyang pahawak nung pain area. Okay? If you palpate it, if you press it, masyadong masakit. So, i-correlate mo yon. However, if you have a patient who has pain, no, and then at the same time, he wants he would want it to be pressed deeper, nawawala yung pain. So that's a classic example of a deficiency condition. And of course, you have to look at also at the tongue. So for now, I don't want you to be like mas stress, because we have a separate lecture for tongue diagnosis tomorrow. By the way, we invite everyone tomorrow for lump auricular medicine. We will start with history and the yin-yang theory. Okay. We always connect everything to the ear. Okay, so yeah. Same time, 4:40, 4:45, then we go immediately to tongue diagnosis for beginners. So kanina, we were so impressed. Were you all impressed with Sir Mark? No, grabe. You could really tell na he's doing it. Like he would look at the tongue. So I'm sure he's now very confident for that. Again, if you don't look at the tongue, you don't feel the pulse, then you did not train with us. Sorry. Some practitioners are saying you don't need to look at the pulse, feel the pulse, or look at the tongue. That's incorrect. You just don't rely on the symptoms, on the history. In fact, the kind of questions that you ask the patient will depend on how well you were able to check the pulse and look at the tongue. Okay? You don't ask too many stupid questions. You only ask relevant questions. And sometimes the patient will be amazed. Bakit mo alam? Okay? So the moment the patient enters your clinic or comes inside the room, alam mo na, even the way he walks, even the way he drags his feet, and even when you shake the hand, no? Malalaman mo na. Minsan the hands are cold, and so you try. You ask only questions that are intelligent. Okay? So when we look at the tongue, we just confirm what is already forming sa utak natin. So at the same time, you would already think of the points. And when we discuss the points here in our training, we would categorize the points. We just don't tell you stomach 36, yung mga ganon. That's medyo ano siya, low end siya, no? So we will have to study even the channels that are not even taken up during basics. We will be taking up the EOV, extraordinary vessels. Okay. And by the way, when we talk about the channels, we will also include yung the ano to? The connect, yung mga musculocutaneous channel, then we have the connecting, luo-connecting, ano pa ba? Yung mga ganon. Okay? In fact, I think tomorrow, that's part of the, not tomorrow. Next week pa pala. Sorry. So let's continue, Ma'am Trix, if there are no other questions. Okay, let's go to the next one. What determines the rhythm of a pulse?
Determines the heart chi, since it
Yeah.
commands blood.
Very good. Sino yung nagtanong kanina about irregular? Oo. Pasensya na po, wag mo na ngayon. So the answer to the question here is the heart chi. Basically, when you check the pulse, it's actually the heart. Pero naging specific lang because it is in TCM kasi um all the organs are interconnected. So the challenge here lies in how good you are at determining what started it all, no? So dito papasok yung knowledge mo sa constitutional factors, yung causative factors na tinatawag, and all these things. Okay? What determines the tension of a pulse?
Determines the manifestation of chi and blood.
Okay. Paulit-ulit lang. So it's basically chi and blood, no?
Yeah.
And by the way, no, you don't need to study all the 29 pulses. It used to be 27 and 29 na now.
29.
Just to give you an idea on how we will tackle this, we will always go back to the basics, no? Like example, when we talk about the pulses that are deficient, no? Iko-compare natin lahat yun, kakategorize natin so that you will know how to compare them. Next, the last one, what do you mean by shape of the pulse?
Determined by the chi and blood, the ascending and descending.
Yeah. Okay. Chi and blood pa rin. So it's basically chi and blood lang, no? And also, when you check what's this? You always compare the right from the left pulses. Okay? If you have a patient with some issues, there will always be a disparity. Just like this morning, I had a patient na medyo bago lang na stroke. Buti na lang na-recover niya. Naka-recover siya. And yun, iba yung pulso niya sa right, sa left. And so I just did the ear because she's a close friend. She was amazed. She liked it. And I let her really feel the pulse. Nagbago talaga. Okay? So welcome everyone. I'm very happy to see na medyo lumalaki na yung pamilya natin. Okay, tanungin. So, ano ko tong recording? I hope everybody loves that. Don't worry, we're going to give you the answers later, no?